necessary that anyone has identified for the minutes? If not, I'll take a motion to approve them.
I'll also make the motion, Madam
We
Chair.
have a motion from Larson. Is there a second?
Second here.
Second from Denny. Further discussion? Seeing none, members in favor signify by saying aye.
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 Opposed? None are opposed. Both sets of minutes are approved. Item number 2 is to consider approval or denial of various license applications. You have them all in front of you. There are a few recommended for denial this evening, so we will visit those. Let me switch packets here. And so under our ordinance, applicants recommended for denial have the right to address the committee with respect to their record. So the first one recommended for denial is Cassandra Gage. Is Cassandra Gage with us this evening? Let the record show Cassandra Gage has not appeared. Dao Yang has also not appeared, and Donald Alstein. Okay, let the record show none of those applicants recommended for denial have appeared. Okay, yep, we do have 5. So there are 5 of them. So then the fourth one, Arnez Miller, has also not joined us this evening. And Andrew Prokudowicz, also not present. So the record will show that all 5 of them have not attended this evening to appeal. With that, there's also event applications in the packets that you've got some details on. All Stars Under the Stars, American Shindig, the Labor Day Parade, and the Wausau Whitewater Summer Race and Event Series, along with the batch of license applicants recommended for acceptance in the meeting packets. Yep, and so then also, let me switch, because I'm switching between packets. Sometimes a paper packet is beneficial, but we don't have one here, so, okay. Also recommended in that batch is 2 license changes that were recommended for approval immediately before this meeting from the Liquor License Review Subcommittee. The first one is a transfer or a approval for a new owner at Applebee's. That one was considered by the subcommittee and recommended unanimously for approval. Also, a new owner at Domino Bar it is also recommended for approval by the subcommittee. So you have all of those in the batch this evening that you see. With that, I would entertain a motion to accept or deny licenses as recommended by staff. If someone wants to put
I also
forward.
make a motion to recommend them, but I would like to discuss after the second.
Okay. Okay, so, yep, we can do that. So we'll take a motion from Larson to accept or deny licenses as recommended by staff. Is there a second? Second by Denny. Go ahead with your question, Lou.
I just want to say 2 things. I guess I'm kind of surprised that Mr. Alstein isn't here, because he's been here for
Again.
2 months straight.
Right.
You know, and why all of a sudden he's not here, because tonight I probably would have voted for his license, but since he's not here,
I didn't send him the letter this time. Remember, he wanted a letter of, to remind him, and I didn't send it, so
Well, so this is the thing, and we've had this discussion. He's been here before. We deferred action last time so that he could come back with different proof of or evidence of rehab. The evidence of rehab that was received is essentially a letter from a friend saying he's a nice guy. It's not, at least in my estimation, based on what we've seen as submitted evidence of rehab in previous cases, it's not the same thing. You know, I guess just as one committee member, I didn't really find that compelling, like some of the stuff we've gotten before.
I didn't either. And my second thing is, you know, being on the Liquor Review Board, Applebee's wasn't represented there, but that passed. But the people that were there taking charge of the Domino, they seem very confident in their business venture, and they're business owners already in this city, and I recommend we move forward with that.
For sure. They actually also are working in consult with the prior owner to get some guidance, which makes for a smooth transition, so we were impressed by that in the subcommittee. I do think that we are to the end of the license cycle for 2023. So on the server license and even on the transport driver licenses, all of those expire July 1st anyway. So with Mr. Alstein not being here again after we deferred action previously, the license that he would get would basically be good for a week. So I think we're to the point where if he wishes to reapply for the next license term that begins July 1st, he's certainly welcome to do that. But, I think at some point we can only wait so long. And I also don't think there's a duty on the part of the clerk's office to basically babysit the applicants and make sure that they appear. These folks appear on a publicly posted agenda. They know they've been recommended for denial. The one was here in person already. I just don't think that, we need to add yet that duty on them as well. So if they're not here, they're not here. But with the motion to accept or deny licenses as recommended by staff, that's how they would go through. Those 5 that did not attend tonight would be recommended for denial. Council would take the final action on those July 11th. And, obviously those same folks can appeal to the council if they wish, but, I think we've done everything we need to do for them. Anybody else have comments at all on the license badge? If not, with a motion and a second on the floor, members in favor signify by saying aye.
Aye.
Aye. Opposed? None are opposed, so those are either accepted or denied as noted. Item number 3 is to consider request for a temporary premise amendment for the 35th anniversary party in the parking lot at Bob and Randy's at 1515 6th Street on August 19th, 2023. And we've got a request from Randy and Tana Scobell. You'll see that they have made a little packet for us. In the past, we have approved outdoor events at Bob and Randy's, I think maybe for the St. Arnul's event.
Yes.
And so all of those we've approved year after year, and none of them have been problematic. They usually have reasonable hours and they work with their neighbors well. But we'll let you talk us through the event.
It would be 1 to 5. In our parking lot, we serve drinks and food, and they buy a special ticket and they get a price. It's from 1 to 5 p.m. The drinks aren't allowed on the sidewalk, no glasses allowed. We card everyone that comes in. They have a wristband. We have a fence surrounding the parking lot. Trying to think of we have porta potties.
Okay.
I know we need to get in touch with the fire department and fire extinguishers, and I have a list of things from when we've done it in the past.
Sure. Okay. Yeah, this looks very similar to the other applications, and all of which we've approved before, and I don't think that any of them have ever been a problem. Committee members, any questions at all on the event? If not, is there a motion to approve the event?
I'll make a motion.
Motion from Henke, is there a second? Second from Denny. Further discussion? Seeing none, members in favor signify by saying aye.
Aye.
Opposed? None are opposed, so that event is approved.
Thank you.
Thank you for coming in. Item number 4 is a request, consider request for a 90-day extension for good cause to open for business per Wausau Municipal Code, Chapter 5.64.160, Sub A for Stultz LLC, premises to be located at 525 Fulton Street. The petitioners were Gizo Urjamelli and Elena Nashki. We had met with them, and I want to say it was maybe February. They had come in with a concept that they wanted to open at 525 Fulton Street. Obviously, we have the ordinance in Wausau that says that an establishment has to get open and stay open to possess a license. It's because licenses are limited in quantity, and there's usually more folks who want them than there's licenses to give. So with that in play, this establishment has not yet opened, and it is miles away from opening. Lots of renovations to be done. We had invited the applicants to attend tonight because if we are to give an extension, we can give another extension. If we're to give an extension, they have to have a plan to get open and stay open, and they have to present that to us, and we have to be satisfied with that before we give the extension. In this case, even though we have approved the license in February, they've never possessed the license because they have never opened or actually physically obtained the license. With that, and the fact that they have not appeared this evening, we have the option to not do an extension we can allow that license to be offered up. And if they have a plan to get open or, open that business at that location, they certainly can reapply. Obviously, all Class B licenses also renew 7/1. We're almost to that point, and they are not anywhere close to being open according to their discussions with the clerk. So, go ahead, Doug.
Yeah, who are we talking with? Can you name who we are speaking to?
I did in the agenda item. So
Yes.
Stultz LLC, the principals of that LLC are Giza Ujamelli and Alina Notchke
Okay, so it's Gizo who's talking
and Elena.
to the clerk and Elena.
They
not
have
the
been working with the
bar-
clerk
Not
to-
the operators.
They are the operators.
They are the
They
operators.
came in wanting to own and open this restaurant, and they've not done that yet. So,
This is the establishment that was where
Trace
Trace Romano's
Romano's,
was there.
right.
And Trace Romano's, I believe that they own the building, and Trace Romano's moved out now. They did say that they took longer to move out than they had anticipated, which is what delayed them. But the last time I went by there, I didn't appear that anything was really being done inside. If they want to make it into a restaurant, they have to do a lot of changes with the kitchen. And so I'm not sure. They didn't specifically request a 90-day extension. I reached out to them for their status to say, what's going on? Your 90 days is passed. You haven't opened. What is your plan? What's your status? And that's when they said, okay, well, we didn't realize that, and they left too late. I told them that they would need to appear at the June 19th meeting to, let us know what they planned, but I don't see them here, so.
well, and under those circumstances, obviously, if they get together a plan and a plan of operation and a request to open, they certainly can reapply. But the ordinance that we have that requires they get open and stay open within a set period of time allows, it really keeps people from holding a license and sitting on it and not operating when there's other businesses out there that could absolutely use it. So, under those circumstances, this particular license would be offered up for applications. Applicants would go to the Liquor License Review Subcommittee to be considered, and we would award that license to someone else, is really the process that we would follow. So if there's no, go ahead.
But do we have, so what, if we let this go, he could end up not being able to open for lack of a license?
He may be in need of purchasing a reserve license if there's not a standard Class B available when he's ready to open.
And okay, so
See, we
We've
can't,
been
they
pretty-
haven't asked officially for a 90-day extension, so it would be foolish of us to award one. There's no dialogue with them, there's no plan of operation, there's no plan for them to get open, and, they aren't here asking for us to vote for an extension. So our only choice really is to take no action at this point, which then allows the license to come available for other applicants, including them. But at this point, not having a firm plan from them and any public dialogue with them, we're hard-pressed to do anything to accommodate their plan.
And I have had several inquiries from individuals looking for a liquor license, so.
So if there are businesses that want to open, the last thing we want to do is allow someone to sit on a license and not be open when another place is really restricted from starting up here.
And this was the place that was going to have the Ukrainian chef.
Yes.
Yeah.
Yes, they had a plan for a diverse menu,
Yes.
different offerings, different atmosphere. And, at some point, if they still want to have that plan take flight, they certainly could reapply. But I don't feel that the committee's under any duty to offer an extension tonight if they're not here.
And the original application was actually applied for back in December of 2022. I held and they, at that time, were considering an establishment on 3rd Street. Then they changed it to their Fulton Street building, so I delayed that to the January Public Health and Safety meeting, which sent it to the February council, which trying to help them have more time, but now that license technically is going to expire June 30th, the license they applied for. And
So-
I don't see any real movement for
Yeah.
a restaurant to be open anytime soon. And we are currently out of regular licenses, so,
So we could be holding up someone else's business plan, really, Go ahead, Chad.
Thanks. And this is just the liquor part of it. If they wanted to open a restaurant, they still could.
They can, and they also can get, restaurants are allowed to get a Class B and Class C wine. Only restaurants can get that.
Okay.
So that they could get beer and wine. It's just the full liquor license that has the quota on it.
Okay.
So,
Thank
yeah, so there would be options for them if they decided to come back in. So if we are not taking action on that, we don't need to vote on that item or take any action. It was more of an opportunity for them to present, but if they're not here, it's a moot point. Item number 5 is a presentation from our fire department. You'll recall a number of months ago, we had a committee of the whole where we discussed Wausau's unhoused population and a lot of the needs that we're seeing as a community. And the idea came up in that meeting about a community care paramedic program. And we revealed then, or we knew then, that under prior Fire Chief Tracy Kujawa, we had conducted an experiment with such a program that was successful during its trial. It was in partnership with, I believe, maybe the medical director at Aspirus. They worked through that together. That program, though, expired and wasn't continued. But the council at the time was intrigued by the idea. And so coming out of that meeting, I had taken some notes. And so I asked the fire chief to look into this because there's other cities that have such a program and see what it would mean for us. So what we're getting tonight is just a presentation on his research, not a request to hire, not the creation of a position. It's not an action item. He would be looking for eventually community partners to put a program like this forward if we wanted one, but not hiring, not funding, not creating positions yet. This is only informational, so I want to be clear about that because I know that we also have our media partners in tow with us tonight, and so we need to be clear with the public on what they can expect. So right now, we're at step 1 of the information piece. So I'm going to turn it over to the chief, and he can talk to you about what he has learned about this type of position. So take it away, Chief.
Thank you, Alder Rasmussen, for that very accurate description of where we're at with this right now. Community care paramedicine throughout the country is nothing new. It's active in Wisconsin, locally even up in Merrill, as you're going to see throughout this, and it's working successfully in many communities. And it can have a wide variety of objectives based upon the community and what impact that they're looking to see from that community care paramedic. And so while this was derived from the COW where we were discussing the homeless unhoused issues in our community, I would anticipate that this community care paramedic would be a small portion of their job. And really, the impact would largely be seen by our aging and elderly and our medically vulnerable in our community. So the objectives, as I described them, for this community care paramedic, if it were to be created in the city of Wausau, would be improve the overall health of the Wausau community, reduce the use of ambulances for first access point for health care that we see not just only in our homeless unhoused, but we also see it in sometimes we have people who are frequent utilizers of our system. And so they will call multiple times, a week, sometimes a day, sometimes a year. And so we'd be looking to reduce those as we have. And I think about that statement, and I should break that down even farther. As all of you know, when you read our monthly and our annual reports, our call volume continues to climb. And there's no slowing down as we see that. I think progressive departments are trying to aggressively find avenues inside their call volume to see reductions in use in order to have availability for those acute care needs of the community. When they need an emergency ambulance, we don't have it tied up with someone with a non-acute issue, meaning they don't critically need an ambulance. A big benefit to our community is to reduce the use of the emergency room. You talk to any of the hospitals which I have about this, and our emergency room use in our community is off the charts. They're overwhelmed. A vast number of their patients come to us as being the biggest medical provider in Marathon County, or pre-hospital medical provider in Marathon County. So we're looking to reduce that. Or the big thing where you typically see, and I'll get to this in the results that you're seeing around the country, is to reduce readmissions of certain types of patients with diagnoses, meaning that they're discharged, they've come in with a patient diagnosis, they spend a little bit of time in the ED, they're in-house in the hospital, maybe they're inpatient for a few days, they're discharged with discharge orders, and then a week later they're back for those diagnoses. This is where we typically see community paramedicine able to drive that number steeply down. Big part of this, build relationships with community partners in healthcare, in the healthcare community, to better overall have an impact on the community health, and to assist our city social worker with healthcare needs for her clients and the homeless unhoused. So next slide, please, Mary. So the Wisconsin DHS is all over this. They've got a webpage dedicated to it. There's several communities that are utilizing community care paramedics, either full-time or part-time. And they have a lengthy statement about this, that community emergency medical services work collaboratively with stakeholders in their healthcare system to address the unique needs of their community. I just wanted to highlight that first sentence of that, the unique needs of their community. So the thing I like about this is that we could use this system to tailor to the current healthcare issues and future healthcare issues of the city of Wausau, which at the time when we discussed this at the COW, a big part of that is our homeless unhoused issue. Plus, we also have plenty of other avenues where we can do this. So next slide, please, Mary. So example programs, probably the biggest and best known in the state, and one that everyone is looking towards for guidance, is Madison Fire Department. They've got 2 programs. They have a CARES program and a community care paramedic program. Their CARES program, I would marry that closely to what our CART team inside the police department is doing, only add a community care paramedic to that team. Their CARES program are fire department employees that respond out of 2 minivans. They've gotten busy enough now that they've got overlapping shifts and 2 crews available, 2 crews of 2 available each day for crisis mental health issues occurring inside of Madison. They also have a very successful traditional community care paramedicine program that works with the pushing down the readmissions of aging and elderly based upon referrals from the hospitals, and those are working really well. Greenfield, the department may be a little bit more comparable to ours, is a full-time 40-hour critical care paramedic that they're seeing excellent results on. And Merrill Fire Department, just up the road, took a program similar to what we were doing, and they're doing it with off-duty staff they're paying off-duty staff, 2 paramedics with an ambulance to go out and do these repeat visits for the traditional reduction of readmission of certain types of criteria. And I'll get to what those criteria for those referrals are. Next slide, Mary. So before I move on, I had several conversations with multiple people that are very knowledgeable in this, including the Madison program, and we would be looking very closely to align with that Madison, both their CARES program and the community care paramedic program. They've made offers that if we do end up going this route, we could send our person down there for as much time as they'd like to ride along to learn from them, and also we'd be looking for some training programs that would align with their programs. So what does the referral process look like for the traditional community care paramedic? And so area hospitals would refer a patient being discharged that they don't qualify for home health care. So they're not going to qualify for that home health care visit, but they also don't need to stay at the hospital any longer. Maybe they don't have a family member in the home to assist them. And then these are these patients in the margins. And we see this a lot in our current healthcare systems, not just in pre-hospital care, but in hospital also. These people often land inside the margins. The community care paramedic would receive a referral. So this is a formalized process already occurring inside the Aspire system with the Merrill Fire Department, where they'll receive a call from a case manager from a patient saying, okay, community care paramedic, we have this patient, here's their patient diagnoses, they're going to be discharged this day, they would like to be referred to you, we're going to send over the charting and everything else like that. They get access to Epic, which is the hospital's system, read-only and adding, meaning that they can't go in and edit a patient's chart, but they can add things along to it. They can read what's going on with the patient, see the doctor's notes, the care provider notes along with that. And then the critical care paramedic would take over that case. The referral diagnosis that you currently see going on is COPD, congestive obstructive pulmonary disease, CHF, congestive heart failure, pneumonia, diabetes, and stroke. And so those 5 criteria are typically trigger points where we see high readmission, high chance that this patient, we've transported them via 911 ambulance to the local hospital, admission through the ED. They've received patient care in-house for these diagnoses, and now they're being discharged. And they're typically being discharged with pretty elaborate discharge orders, some new medications, and then a referral date down the line to see their primary provider. And typically, these are very high-risk patients for, they've got high mortality rates, honestly, and they're also a high chance of calling 911 again, because a week later, they maybe have not followed their discharge orders. There's other environmental issues going on in their home or their life that doesn't allow them to follow those discharge orders, and they are now putting themselves at high health risk, and then they get readmitted, typically through an ambulance transport. So it's a repeat ambulance transport for us. These types of criteria, and I'm not an expert on Medicare law, but if they're readmitted after discharge within 30 days, a lot of times this is a no-pay patient for the hospital. And so it's really a lose-lose situation for us when we have this patient that could potentially do fine at home if they have some access to some help after they get discharged, but they don't qualify for that home health care, and now they're at high risk. Next slide, Mary. So what does this look like? So the first at-home visit, so when they get the referral to the community care paramedic is very structured. They're going to get 2 at-home visits from the community care paramedic. And they're going to have a variety of assessment tools that they go out with that's in their cadre of things that they're going to do with this patient. First at arrival is just overall condition of the home and their living environment, and that's more of an anecdotal. You know, our paramedics work in patients' homes on an everyday basis. We understand what good living environments look like and when they don't look like good, healthy living environments. And so it's that kind of overall impression that they get. It's also a chance for us to gain vitals, do an assessment at the paramedic level in their home, so that's why we need the equipment that we go in. And now they'll start moving through some formalized assessments. We have a food security assessment. Do they have proper nutrition in the home that matches what their discharge order was for nutrition? We see frequently that these patients in the margins have to make a choice between very expensive pharmaceutical needs that they have on their discharge orders and food. It can be that simple. Can they afford their meds or can they afford a good meal? And do they know that there may be access to help them with the pharmacy needs that they have or meals, things like that? This is where this community care paramedic becomes the connector between community assets and this patient's needs. Next, trips, and falls hazards. Wausau Fire Department this year will do near 7,000 calls. I'm anticipating 6,800, 6,900 calls. I can guarantee you that our #1 reason for dispatch for Wausau Fire is falls. Our aging and elderly are at high risk for falls all across this country. That's nothing unique to Wausau. It's what occurs. We do have some fabulous resources for falls prevention programs through ADRC, and we've already linked up with them, and we are already doing patient referrals in our current system to ADRC for at-risk people to get training and education, maybe a site visit from ADRC to try to reduce those slips and falls hazards in the home. Typically, it's area rugs, it's problems with layouts, it's just not understanding where those falls can occur. Of course, for the fire department, so we're going to do a fire and life safety assessment. We see high mortality rates in fires of people who have underlying medical conditions. They're not the ones that can flee their home quickly. They're not the ones that can have a high responsiveness to a fire alarm or even hear one at night, or if they even have one that's working in the home. And typically these are people that maybe have to get a walker or assistance in moving around. We see a high mortality rate in aging and elderly, especially with comorbidities in fire. So we want to do a fire and life safety exam. And then lastly, we want to do a prescription drug assessment. I'll tell you, over a career of doing this in the field, when you ask a patient, where's your meds, they often refer you to a bin, a basket, or a cabinet that's overflowing. Many of them are expired. Many of them are prescribed by different providers for different things. And we see frequently poly overdoses in the field because they just don't they've got so many medications, they don't understand what to take when. And so this is an opportunity for us, for a community care paramedic that understands the usefulness of all those, has the chart from Epic on what the patient is supposed to be taking, and finds out what they have at home, if they have a routine set up, do they have help in laying out those meds daily, weekly that they need, and does those assessments. And then upon return, they start writing their report. So they've got to do a report inside of our normal report writing system, plus they'll add notes into Epic. And they will arrange at that time a second field visit within a week or two of that first one. So next slide, Mary. So they'll go back out that second time and do a reassessment and then referrals from there and just try to be a help from there. So homeless healthcare access is the other area where I think this would be our opportunity to uniquely tailor this community care paramedic position to the city of Wausau on our current needs. And that person would basically serve as an asset to our city social worker over at the PD side for alternative access to healthcare needs. Just today, we were to Catholic Charities and we were to community partners for 911 calls. Those calls, I didn't look into them depthly, but could they have been potentially prevented, a 911 call with a phone call to, if the Catholic Charities and the community partners has a healthcare provider, a paramedic, non-emergency number, hey, we've got this going on over here, what do you think we should do with this? The result, the result of that, we don't know. We don't know how often they would access that, but I do believe it having an availability and having those relationships, it would be utilized and could help depress our 911 use of our ambulances for access to health care. I think the biggest thing with this position, and again, this is all, theoretical, is to build these relationships within the community with public health, North Central Healthcare, all these other access points to healthcare needs, or the healthcare needs of this community to assets that exist, and building those conduits and allowing, assisting our community in finding those assets that are available to them. I think that's one of the biggest tools that will have that person to have in their toolbox. But it's also one of the biggest hurdles because we have to have the right person. We've got to have a team builder. We've got to have a relationship builder along with that. Next slide, please, Mary. So what does this look like? This is what our internal conversations have been. If we're going to do it, I think that it's worth a 3-year trial. I think 1 year you're going to gather enough data. You don't want to be on, your head to the gun or a gun to your head, whether you got to make a decision with 1 year's worth of data or less than 1 year data if you're going to keep going on. I think it's got to be at least 3 years of a trial. I think what we want with this person is they got to have some street experience. Our best paramedics are the ones that have been on the street at least for 3 years. They get really savvy about talking to people in their homes. They understand what our system looks like, and when they can utilize it, they may go out and discover a patient that is in need of a 911 ambulance, and then they're a part of that system. They're not from the outside of it. Preferably this community care paramedic will have some community care medicine background. We've got a few paramedics in-house right now that were part of our trial program that we did years ago under Chief Kajawa. They must be a relationship builder. They got to work independently. We're going to fully equip them with a cardiac monitor, all the other proper evaluation tools when they go out the door. We need to give them a dedicated department-labeled vehicle so they have their ability to be mobile. Most of the time, they're probably going to be working out of this car. Needs to be all-wheel drive, those types of things. And then we need to have an office, and honestly, that office space is probably one of our biggest hurdles. Right now, we have 6 workstations in our main office at Station 1, and I have no idea where we're going to put this position. But as I've been told by our staff in the past, if we can get the bodies on board, we'll stack them in the hallways if we have to. So I think that our staff, as I've discussed this with them, they see this as a really great potential program. I think we've got several internal paramedics that would be very interested in it, this type of position. I think we could recruit a very excellent paramedic into this position if we do create the position. Next slide, please, Mary. So what is this? What's our theory on a proposal for this? I think this has got to be community funded. I think that it's got to be a combination between the city of Wausau and maybe Marathon County. Marshfield Health, Aspirus, I've had conversations with both of them. I've had conversations with some area foundations. I'm seeing some forward leaning into this. Definitely enough that I think that we could have, they're willing to offer some early numbers that I won't discuss in public yet. But I think that we're seeing enough leaning into this position that if we get serious about creating it, that we can develop some strong community partners. And as you'll see later on, I think that those community partners, especially our healthcare systems, Aspirus and Marshfield Health, they stand the most benefit from it financially in the end. Several of our area foundations, this marries up really well with exactly what they want to do, which is improve, overall health in the city of Wausau. So again, 3-year trial. I think that this paramedic needs to produce at least quarterly and annual progress reports. It's got to be a data-driven program. This is where we're at now in the fire service, evidence-based, data-driven decision-making, meaning that we have to see annually that this is benefiting our community enough to continue the program because positions are expensive. We hope that it can continue to grow and we could see a possibility of growth and partnership with our collaborative partners in the metro area, Safer and Riverside Fire Departments. I think that it definitely has that type of potential. And when we talk about potential load, which I got into some really early conversations with one of our healthcare providers on that, I think we could see, literally hundreds and hundreds of patients referred to this program annually. Right now, Merrill is in the small trial program, and they're doing 2 to 6 patients a month. And I think that that's just the very tip of the iceberg. So next slide, please, Mary. So this is where the rubber meets the road, right? What's the program cost? So here's some early numbers that I threw together. I used for wages, I used the wage on our union contract for a 3-year firefighter. If that's what we're going to target, to have somebody with some experience, I think that's where you got to start. Their wages plus roll-ups around $110,000, with all the benefits of health insurance, Wisconsin retirement system, and things like that. Equipment, the first year, it's going to be heavy on the first year. That cardiac monitor alone is like $50,000 of that $65,000, but we have to equip them with the identical equipment that we're using on the ambulance. We can't give them anything short of that. Then all the other equipment and bags and stuff like that to carry it in and transport it. We get good life expectancy out of that. We buy really quality equipment. It's not going to be something that we've got to turn over every couple of years. It's got a good long life expectancy. We need to get this person trained. We need to send them to one of the best training programs that they are. We're not going to find someone with a great deal of community care paramedic experience because there's just so few in the state that have that. And all of them are already employed. We've got to find professional affiliations to tie this person to. I'll personally attest that my professional affiliations inside the International Association of Fire Chiefs, the Wisconsin State Fire Chiefs Association, are huge in assisting me on an almost everyday basis in doing my job. When I'm wondering what's going on in other communities for success, I lean to those people who are my professional through those professional affiliations. We need to lease a vehicle, which our fleet manager is telling me about $1,000 a month, so about 12 grand. So first year, my rough estimated cost about $192,000. Then the next year, we don't have to have all that upfront equipment costs, and we're not going to have all that upfront training costs. So I threw some round numbers in there, and we're probably at $130,000 a year from there. I'm really hoping that this conversation with you tonight, you can help steer me on what we need to see from community partnerships as far as maybe a percentage or what we need to see as I talk with these community health partners if we decide to create it. To be successful, these are not small numbers that we're talking about to create this. So next slide, Mary. So cost-benefit analysis. So luckily there's been a lot of them that's gone around the country. I've read a pile of them. The best case studies that I found was out of California. I'd be happy to email it to the committee if you'd like to see it, where they closely examined 7 community care paramedicine programs that had thousands of patients in it. So this is in small programs, and they evaluated 7. 6 of those 7 really showed high yield, are consistent with their findings, meaning that what they found, what they thought they were going to find through the research that they consistently found out of 6 out of 7 programs. All of the programs were shown to have a positive benefit. The primary cost savings, and this is the thing that we need to understand going into it, the primary cost saving isn't to the city of Wausau, it's to the healthcare provider and the payers, meaning the patients. And sometimes it's not the patients themselves, but it's Medicare, it's their private insurance, or whatever they're using to assist them in paying their medical bills. So the patients are our Wausau community taxpayers, so there is some savings to that patient directly. But I can't say that I'm going to have, at the end of the day, that I've dropped my budget X number of dollars because we created this program. I don't think that number is going to exist. I think that we're going to see it in an overall health benefit to the city of Wausau, absolutely. I think that the individuals that this is going to assist, it's worth it. It's going on in other communities, and it's being implemented. All the California programs were shown to have improved patient well-being, and they're using really good metrics to look at that. It did reduce repeat calls, frequent utilizers of the EMS system, but as I put that last quote in there, in most cases, yielded savings for healthcare plans and hospitals. And so those are the ones that are most likely to see the benefit for that. And last slide, Mary, this is just where I hope we can open a conversation and talk about this, if this is right for our community, and if you want me to press on with it.
Okay. Thank you for that, because that was valuable research. I think that when we started down the path of this discussion, we knew that it wasn't only about our unhoused population, even though There is an awful lot of EMS activity that follows that population, and they often don't have folks to look out for them and check in on them. We also, even in our first trial, recognize that aging in place is huge for our community. We have an aging population. We've indicated that we want to be an age-friendly community. And so I think that, at least in that first trial, when they selected those patients, they were those people that you mentioned, the CHF and the diabetes and the fall risk and the, chronic obstructive pulmonary stuff. And there are often people who just don't have family here that could check in on them. Sometimes once in a while, maybe a neighbor will look in on them, but it's not consistent or frequent enough to, consistently say, did you get your prescription and did you take it? And, stuff like that. So currently, I'm still sitting on the Healthy Marathon County Alliance, and one of their goals is to be the healthiest county in Wisconsin. I mean, we want that. So we also have demonstrated that when it comes to services like this, we're able to share and collaborate. I mean, we have a couple communities in our area that share our humane officer with us, and both communities benefit from that. Even though we've created that position and she's housed here, her services reach out beyond just the city limits, which is helpful. So I do think that given the fact that there's a large benefit to be gained through for the patients, for their quality of life, for health insurers, for health systems, I agree about the community funding part. The city and the taxpayer certainly could not go it alone and should not. We had funding for the trial that we did in partnership with our hospital system. And, when that funding ran out, the trial ended because we could not afford to keep that going. But I do see value in it. And I think, with the proper partnerships, if we could cultivate, especially our health systems and foundation dollars to get us off the ground to try this, it really could be huge for us as a community. Committee members, what do you guys think? Go ahead, Lou.
Thank you, Madam Chair. I agree wholeheartedly. One question I would have, though, is the wage for the employee, $110,000. Is that for one?
One employee, 1 year. Yep.
Okay, because my question would be, how would you operate with the billing? I mean, would you have to hire more staff for?
There wouldn't be billing in this case.
There what's that?
No, the patients, and maybe I should have been more clear in my presentation on that. When we go out to do those site visits, those are referrals. That is at no cost to that patient.
Oh,
And
okay.
so that's why it needs to be community funded, because the healthcare provider that makes the referral to us, in my mind, needs to be part of the funding of this, so they have that access to that community care paramedic for those. And we don't have, there's no conduit inside of our fee system to charge for a community care paramedic visit like that. And all the programs that I was referencing up here, and I should have been more clear about that, are at no cost to the payer. That this is a community care paramedic that is community funded and available for those patients that meet those certain criteria to fall within that.
Okay, thank you for that.
Yeah.
Okay. Doug, go ahead.
Sure, thank you. I think this has good potential, and I think you hit on it. The number one savings is going to be the hospitals. I'm sure they know the number to the penny what it costs somebody to come in the emergency room for a repeat case. So we need to be able, I don't know how we capture that data. They know it, I would think.
Yeah.
And we could, if we could capture that and get a portion of that, I would think the, like you said, North Central Healthcare has to have, should have an impact. Health insurers possibly. Alder Rasmussen touched on community. Are we talking potentially outside of the city limits of Wausau, or are we talking right now just city of Wausau?
Well, and that's one thing that I've been asked by the healthcare providers is where do we want to see this go? Because obviously, their patients don't have borders. They're getting from patients from all the different providers. It would be my recommendation that we start with our Wausau Fire Department Emergency Response District, because these are the people that are paying us to start with, to have access to this, and see where it grows and goes. I would hate to commit to provide to the metro area our community care paramedic if the city is substantially assisting and funding it, and we've got an overwhelming number of patients. Now, if we see an overwhelming response from the healthcare providers and the foundations to fund this position, then I think it's wide open. These are my opinions, on this. I'd be more than open for hearing the opinions of the decision makers, about where you envision this person, this community care paramedic, being able to go to respond. So Merrill, how they defined it within that Merrill, I believe it's the mailing addresses that they're using. If you have a Merrill mailing address, which they cover, they're very big into rural EMS, which as we are too. We cover the city and then everything to the north of us, so the town of Wausau, Texas, Hewitt, the village of Maine, those are all of, we provide EMS to those. But as you'll see in the reports there, the bulk of it, so I think that the last number, we did around 500 emergency medical transports in the city, and then we did single digits, 1, 2, or 3 in those rural jurisdictions surrounding us. So it wouldn't be an overwhelming number to those.
Okay, one more question.
sure.
Okay, well, it's probably not possible to completely pay for itself, but I think we could really mitigate or offset a lot of the cost here with those. And just looking at the mechanics of it, if you send that referral or we send that paramedic out in a truck, what happens if they determine they should be transported? They can't transport them in a truck?
No, then they call back for an ambulance.
Okay.
And that's why I think they need to, it's a system approach. And so we've got this community care paramedic. We've equipped them properly to evaluate a patient. So now you get out there and, a patient looks fine, but they've got, they were just discharged for a stroke and now they've got hypertension that's through the roof. And we know that they have a very high potential of stroking out. They need to be transported to the emergency room to get this under control. That community care paramedic picks up the phone. No, they're likely not to dial 911. They're going to, and we, they've got to have a radio too. One of the things that came up as I was discussing this with some of our community partners was, what are you providing for safety? What are you providing for safety for that single paramedic? That's why they like the 2-paramedic program in Merrill, because they've got a pair of paramedics going out with an ambulance, and so therefore there's a safety in 2s. And I said, our paramedics are really street savvy, and I don't think that when we go into someone that's been discharged with COPD that they're at high risk to themselves, But that's why we equip them with the radio and training and everything else like that. And frankly, it wouldn't be affordable if we were trying to put 2 people on every one of these calls. So that it is there's a lot of things here that I think that are unanswered, but when I do the cost benefit analysis of this thing in my own mind, and I can understand, it's all the years on the street too, seeing patients that you just transported last week. They had a really high chance of being successful on their discharge at home, and now they're crashing. It's a shame, and it's just because they maybe didn't have some help. And a big part of that too, and I didn't put that on one of my bullet points, or I meant to describe that in one of my bullet points, is understanding their discharge criteria. Just sitting down with a paramedic, all right, you just got discharged from the hospital, it's overwhelming, you've got all these people working on your discharge, case manager, the doctor comes in, you're visiting with the nurse, you get handed some discharge papers that describe it, but now sitting down with a community care paramedic in the comfort of your home, and they can help you understand that. And then another layer to that, say if you work, wherever you seek your medical care, Aspirus has got the My Aspirus program. Marshfield Health has got their online access. Does this patient know how to access that, where they can communicate through their doctor through a messaging system or an email rather than having to call 911 to access? So I think that there's a lot of layers there that would benefit this community greatly.
Well, and I think there's certainly value in learning to walk before we run.
Yes.
If we would try it, our first trial was in the city proper, and it was a referral system where the health system picked the patients. I think that was helpful. There's value to that. I would certainly, if we were to create it, love to see it expand and go regional, because like you said, the healthcare systems are getting patients from everywhere. And, if there's a service, the thing is that when we share services like that, there is a complex system of memorandums of understanding, and there's legal requirements, and there's like contractual approvals, which, they renew every year. And once you have them in place, they're easy to keep going. But I think the getting off the ground, the contractual arrangement takes more time than we might think, just to offer a service and provide it on a regional basis. But I think as a test, if we wanted to do a 3-year trial, it would certainly make sense, since the brunt of your ambulance runs are here, that we would certainly endeavor to start here. Now, I know when you and I talked about the presentation tonight, we expect that there will be likely a future presentation, which is a proposal for us, where, once the chief has some of these funding concepts together, to show us how we could pay for this, and assuming if there's a gap that we would agree to fill the gap, then I think our action, once we get that presentation from him, if we want to know more, is to then, if we want to do it, we would make a recommendation to the HR committee to create the position. We'd make a recommendation to the finance committee to fund whatever our share would be, and then the council would make the final decision. So we've got some steps to follow, similar to the steps we followed when we created the new firefighter positions, right? We went to all three committees and we followed a progression. We would do that here too. So if you guys are of the mind that you want to know more, and have him continue his talks in the community and bring us back a legit proposal, I think we would certainly want to hear that. Chad, did you have comments?
No.
Oh, okay, sorry.
No, but I'm all for it.
You
so.
looked like you wanted to talk.
Well, and that's, I really needed to gauge this community, this committee before pressing into that work of, to pull a full proposal together and begin making at least verbal commitments with some of these healthcare providers in our community, and then bringing it here, right there. That's quite the process. Now, I in my conversations with them is that we're looking at the earliest is creating this is January of '24. I think that we've got a budgetary process that we're about to go into.
Yep.
We've got some unknown financial things that the community, the city's in. The fire department just got a dozen paramedics firefighter paramedics that we're busy integrating right now. There's a lot going on. And so I think that, before I went on to do it's a lot of work, right? Gathering
Yeah.
this is a lot of work. And if that's the kind of the gauge of this committee is that you'd like to see more information, I'll put that together.
I would love to see what funding is available. I think then we know, like, is our gap, is it 25%, is it 50%, or somewhere in between? What
Yeah.
is it? And, I think once we can put a calculation to that, then we can figure out, like, where our fund sources lie as well, and, what we would be willing to invest as a community. Like, as you said, the 2024 budget process starts this week. CIP starts Thursday. And that's the kickoff of that process. But then, obviously, it takes the entire month of October for finance to pull their act together with the draft budget, and then the council gets it in November. And so I think the soonest we could take flight on something like that is next year. And we maybe even could look at positioning, like, what that start would even look like. Sometimes when we budget for something in a year, we budget for that start to be maybe in the second quarter or in the, or whatever that timeline might, maybe it's at midpoint of the year, because that then allows time to scale into the budget as well for the following year, where you'd only have half the impact in the year that you begin at whatever point. So, but I would like to know a little more about what at least conceptual commitments would be out there for us, so then we can do a little more calculating. How do you guys feel about that? Everybody's nodding? I
right.
think we're excited to know more.
All right, I'll press into that. Chief Kajawa would be really pleased to hear this, because this was one of her visions for the
Yep.
department that, she accomplished a lot in her tenure, and I tried to pick up a lot of that she was doing and carry forward with it, and this was one that was high on her agenda, so. And she was a very smart woman, so I'm glad that we're
Did a good job,
moving
and the
forward.
trial was inspiring. I
Yes.
think when we first debuted it, there was we had a lot of learning to do to understand it. And I think understanding that it's got multiple benefits, and it's really about quality of life for people who's just don't have anyone really to check in on them. And, when you think of someone who's, like you said, discharged with medical orders, whether it's an event or surgery or whatever, sometimes that stuff is hard to understand. So I think just getting people the help they need, knowing that there's not a bill attached to it, is helpful. So, okay, well, we'll leave this. We don't have to vote on this because it's informational. So we'll leave the chief with the direction that we would love some numbers.
All right, I'll put
And
that
then
together.
once he's got that ready, we'll take him on whatever future agenda he's ready for. So,
Thank you.
All right, thank you for that.
I'll just stay here for the next agenda.
Yes,
item.
because the next one is the operations report from the fire department for the month of May, which is in the packets. Anything notable on the report that you want to discuss with us, chief?
I'm going to put it in front of me here just so I can refresh my, oh, yes. So I think the biggest thing that we can talk about in May was, we've been on this hiring process of finding the very best of the best of firefighter paramedic candidates that we could find. And we got very selective with us lowering the requirements that allowed us to do that. And I can't tell you how thrilled with the results we are. We swore in earlier this month on June 2nd, but those people, big share of those people started in May. We swore in 11 on June 2nd, and on May 8th, we had two of the paramedics that were brand new to us, John Lauer and Nolan Buffler, joined the department. And then on May 9th, we began an academy, and we had 3 paramedics that we had hired that were currently finishing their schooling from Fox Valley Technical College and Midstate Technical College, James Brockman, Ashley Sakis, and Ethan Cordova. And we put the 5 of them through a month-long academy. And the results are just overwhelmingly positive on all 5 of these candidates. And so we're really excited where we're going with that. So that was one of the events that occurred. I wanted to highlight publicly Mayor Rosenberg and Alder Denny's attendance and performance inside the Fire Ops 101 training program that was put on by the Professional Firefighters of Wisconsin, which is the state-level union. They put together a stellar event down at Madison Technical College, and both Mayor Rosenberg and Alder Denny represented the city well. Every time there was, in their small groups, someone they asked, one of the instructors would ask, who wants to grab the nozzle, who wants to grab the jaws of life to cut a car door. They were always the first in the hand, or the first to raise their hand, or the first to grab the piece of equipment. It was really a great event, and I appreciate them coming and learning that day. Other than that, we had a few fires. Jeremy Kopp highlights in his area of the report. May was EMS week, so we celebrated that. One of the things that I'll point out that Jared Thompson put in his EMS report, and we don't have the pages numbered, but if you go to the first page of his report, we're seeking CAS accreditation. This has been something that I've been working on since I started my tenure as chief, and we're coming to the near conclusion of that. And I'll tell you that the bulk of it is the work in getting ready for the site visit. We anticipate the site visit is going to be in early July. We're waiting for them to firm up the dates. So I'm hoping that during July we get granted this CAS accreditation status. We'll be the only 3rd department in the state of Wisconsin to reach this status. And one of the things, it's part of the journey. It's the journey, not the destination, right? Part of that journey to CAS accreditation is we found that one of the things that we were not doing was surveying our patients on their care that they're receiving, their satisfaction report. Like you see, if you go to the clinic, you go to any healthcare provider, you're going to get a survey back asking about your performance. We were not doing that. On our CAS accreditation, platinum level EMS agencies do that. And so we started doing that. We didn't know what we were going to find. The first surveys went out, and what we're finding is that month after month, now that we've been doing this, I think 3 months, we're at or above the national benchmark that's set. And so you can see in this report that we scored 92 overall. 224 EMS agencies are reporting almost 7,100 patients. 31 of those patients were ours, 31 patients returned. It's just like anything. I think you see a small percentage of those surveys that returned. And what we're seeing is that our patient care experience for the people that we're treating in the field is very high, and I'm very ecstatic about that. We're not seeing any red flags in areas where we've got to do any work. And that's really what we were looking for, right? Where's areas of our strengths and weaknesses where we can build our weaknesses, and we're finding that overall we're doing extremely well. So thrilled to share that with you. Some other highlights by training division chief Briggs about the academy and things like that. Other than that, I don't have anything specific to spell out. Is there any questions about the report?
I'm glad you brought up Fire Ops 101, even though that is an intense experience and an intense day. I had the opportunity to do that with our crew up in Merrill in 2010, and it is an experience like no other. Hands down, it was my favorite experience that I've ever experienced on the council. I mean, you are put in situations that the average person never is put in, and sometimes you're surprised at how you react to that. And so I felt it was the most beneficial in understanding the work people do, and understanding that I individually could not do that job, but understanding that the special people who do it every day, when you get a request for either time, talent, or equipment, you understand it better. I mean, even if it's not your daily work, if you put on the gear and you do that job in a controlled setting, you really have a different understanding of the people who do it in a completely uncontrolled setting. So I love that we were able to give that opportunity, and I love that Alder Denny and the mayor were able to take advantage of it, because it's awesome. So love that. And I also had the good fortune to attend the swearing-in ceremony on June 2nd, and it was awesome, historic. Never 11 at one time, right? So Their families were there. Historically, they always have a badge pinning ceremony. They choose a loved one to help them enter that ceremony, and it just was really great to see. So
It was a wonderful event.
it was a great day. So does anyone have anything else about the report? Doug, go ahead.
Yeah, I'll echo that. I would recommend if anyone has a chance to do the Fire Ops 101 event, give it a go. I hate to sound ageist here against the mayor, but I'm as old as the Central Fire Station, and I think I sweat a lot more than she did.
It wasn't a
This whole
competition.
bag of bones, I tell you.
Yeah.
It was eye-opening. It was a good experience. But I have a question on the extractor. That's a CIP request for
Yeah.
a new extractor.
Yeah, we'll be discussing that. Our CIP will be, I believe, on the 29th.
Yes.
We won't be here on the 22nd.
It's the following Thursday.
Yeah. So the washer extractor, you just want to hear about generally what that is?
Generally, so right now, you're transporting the gear to another station?
Yeah, yeah.
Okay.
Yeah.
All right, that's
Yeah, we had, when we built new Station 2, we built into the cost of that station, a washer extractor dryer out there in a specific room. If you take that tour out there, you'll see that specific room where all that gear goes to keep it separated from the firefighters. And now with Station 3 not having it, it's kind of evident that, we're having to transport that gear. It's putting them out of place. It's giving them more, exposure to the potentially cancerous risks that contaminated gear contains. And so we applied for an AFG grant last year. I felt confident about it. Unfortunately, that's the first grant that I've written as chief and didn't receive. But I try not to take it personally, and we're going to have to persevere and find a new way to fund that. So.
Sure. All right. And so, the CIP committee starts this week, continues the following week, and then they'll rank and score all those requests from every department. So we're good on that. Any other questions about the fire report? If not, we'll place it on file. Thank you for that, Chief. The item number 7 is the tavern activities report. Chief Bliven had somewhere that he needed to be, so he has left us. But if anyone has questions about items that you see either on their operation report or on the tavern report, I'm sure that we can reach out to him individually and get the facts on that. Anything in general that you see on the report that you wish to discuss? It looks like a pretty
I don't
normal.
wish to discuss. I just
Pretty
see it's
normal
been a
month.
very busy month.
It has. I mean, obviously, the summer season is heating up, so, but absent any discussion on that report, we'll place that on file as well. That brings us to item 8, which is our community outreach update. So first, we'll get our monthly report from Tracy Rieger, and I believe then also in attendance tonight as connected to her report, I've invited the director of Open Door, who's operating our unhoused day center, Bob Grady, and he's going to come up and just give you a little synopsis of how things have been going since they began. So welcome.
Thank you. What an awesome report, Chief. Amazing. Kind of looking forward to that, more information on the community paramedic as well. So for my report this month, I'm not going to spend a lot of time on it. I want to give Bob the opportunity because I know the day center has been front and center for the council and in this committee, and I want to give him the opportunity to talk about that. Our unhoused data this month that was provided to me puts about 251 unhoused individuals in our community. About 86% of that sought shelter this month, and about 14% remained outside. I don't think that number was very different last month to this month. So the one thing I did want to point out in the report this month is that the amount of nights that both shelters reached capacity was very low. So I think it's important to highlight that as there's other activities of enforcement happening in our community, to note that the shelters are not over capacity as a result of that, and I think that's important to point out here. There are notably a fair amount of turnaways, and next month I plan on breaking those turnaway reasons out a little bit further because they aren't all due to capacity issues, and I just want to make sure that I'm very clear about what those turnaways look like from shelter to shelter, because a lot of them, for example, with the Salvation Army, might refer more to ineligibility of programming due to criminal records, et cetera. And then with Catholic Charities, there's a fair amount of people that get turned away not due to capacity as much as arrival time to shelter and strikes that have been given out. So I will break that down for you all next month. In terms of my activity helping get individuals housed, the month of May was a pretty good month in terms of being able to provide 6 individuals who were homeless into housing. And at the time of this report and this meeting tonight, for the month of May, 100% of the individuals that I have housed remain housed as of May. So we continue to collaborate. I'm continuing to collaborate with the Open Door and Catholic Charities, St. Vincent de Paul, all of our agencies here in town to provide the best resources available to the unhoused population that we have. So I do have a story of success in my report. If anyone has any questions, I'm happy to take those now.
Okay. Does anyone have questions about the outreach work that Tracy's been doing? Not, it's exciting. I mean, it's just exciting to see 6 more housed. I mean, it's a continuously progressing number, and since November, and we are so proud of you and your work. So
Well, thank you. Thank you very
for
much.
that. You
I
are
couldn't do it alone.
Much appreciated. Okay, so Bob, if you want to come up and just give us a little snapshot of how things are at the day center and how things are going over there.
Thank you, Madam. So since I first last reported, I just wanted to give you some of the numbers, not all of them, and bore you with all of them. But since March 1st, we have had a total of 4,337 visits to the shelter. Now that construes if somebody comes in the morning and comes again in the afternoon, that still only counts as one visit. So these are 4,337 visits since March 1st. Since the beginning of January, a total of 6,600. What I found very interesting was that this also construes 538 different individuals that we have served that make up those numbers. Since March 1st, we have seen 232 people that we have not seen, at least not, it would have been before January 1st of 2022. So this is in about a year and a half period that we have seen 232 new people come into Open Door for the first time that we have seen them. With specific regards to these folks, we partner a great deal with Tracy on this because the questions I ask these folks are, where did you come from? Why did you come to Wausau? Are you from Wausau? How did you get here and why? Because we're finding a growing number of people who do not have a particular past connection to our community, and in many cases, when we dig a little bit deeper, we're able to discover that they do have connections in other areas. And I partner with Tracy, and if we are able to find a vetted, true source that they are able to return to or go to, we don't just send a person experience homelessness here to another community and create that situation for them. So when we are able to work out arrangements either by bus or other types of transportation to an individual, we do so with the assurances that they have some place to go, that they can stay, not another shelter or not out into the streets. So that has been fairly successful. Just the day-to-day operation, most all of the facility build-out has been completed, at least the schematic of that, the infrastructure. We took what was our kitchen, which was the primary area that people came, that is now mostly a lobby area, and have more than quadrupled the kitchen capacity alone. We now have a dining area and kitchen where we're able to take previously prepared food from a variety of different donors and offer that, and still have tables for 25 people can eat at any given time, as opposed to the 3 or 4 or 5 and the rest were having to stand prior to getting the ARPA funding. We distribute about an average to about 8 to 10 people a day we provide clothing for. We distribute 10 bus tokens per day. Facilities-wise, we also are working with Brian Stahl to find out that our capacity will be at 49. So the 37 people a day that we are on an average seeing is going to be well within our capacity because at no given time are there 37 people usually there at any given time, so we don't have to worry about being over that limit. There's food available, as I mentioned, throughout the day. We expanded from 2 computer workstations to 4 that we can offer to our guests. We put in a new phone system, so we now have the ability to more efficiently communicate within the center, as well as now offer 2 cordless phones to a guest if he or she needs to make phone calls to make arrangements for, or be it at a medical appointment, follow up on a job interview, and so on and so forth. So in terms of offering some programming, that's been a little bit slower than we anticipated. We are working with Goodwill, and we're going to be meeting with them later this week to talk about a variety of different employment-related types of programming. And a person that we just hired last week, in addition to the other qualifications that she brings to the job, is quite an artist in her own right and is very gung-ho on developing an arts and crafts corner so that we have activities while people are there. And quite by circumstance, we acquired a TV that was sitting out on a lawn someplace that said, "I do work," and it does. And so we will soon be getting that up. So there are things for people to do, games, arts and crafts, and things like that. So, and finally, one other thing, to look at the crowd that we do not want there. I've been working with Chief Bliven in order to have patrol come through there almost on a daily basis, and it's very randomized. So the unwanted elements, be it drug dealers and other people that really do not belong in our center, are beginning to shy away, and some of those faces we're not seeing anymore. And overall, the sense of ease has been greatly lifted, and probably the thing that we've created that is the most significant for our community is that the tote room program that we started. We have 32 large bins that people are able to come in as soon as we open at 5 a.m. And as long as they pick up their backpacks and the likes of that, they don't have to come back till 6 o'clock. So they're free to be able to get around in the community without hauling 3 or 4 or 5 backpacks that collectively probably weigh over 100 pounds in many cases. So it also has created a safer environment within the center because we don't have to worry about people getting into somebody else's belongings, taking their other belongings. There were some verbal fights, mostly a couple physical fights, that it came over each other's property. So it's to help them, it's to protect their property, and overall to be able to navigate around the community to take care of the business that they need to do throughout the day. So,
Thank you for that report. Excellent to see that the program and the funding that was allocated by the council is really making that impact that we want to see out in the community and serving the population that needs those services. I suspect that increased utilization of the day center may relieve some of the pressure that we had seen on other public buildings, perhaps infrastructure as well as the library. So, that said, it's great to see that plan has come together and is really serving a great need here. Does anyone have any questions about the report? If not, we'll place all of the reports on file. And that's our last item for tonight, so I'll take a motion to adjourn.
I make the motion to adjourn.
Motion by Larson, second by Henke. Members in favor signify by saying aye.
Aye.
Opposed? No one's ever opposed. We'll stand adjourned then. Thanks, everyone.